The Rishidze State of Health report has revealed that many members of key population with HIV in Gauteng are afraid of going to clinic because of fear of stigma and unfriendly health staff. In a survey done by the organization, 65% of people thought that clinic staffs were always unfriendly. The survey also identified that people living with HIV are struggling to get ARVs when they relocate. In 2022, 338 people interviewed in Gauteng had been denied services because they did not have a transfer letter from their previous clinics. The report suggests that these findings, the failings also in the health system, contribute to slow progress towards getting everyone to start and stay on the HIV treatment. Meanwhile, there are calls for urgent action and reforms to put in place in order not to undermine the gains South Africa has made in the HIV response. And to talk about these, I'm being joined live on the news by Indivuwo Rambau, who is the project coordinator at Rishidze. Good morning, glad to have you join me. Now, could you provide an overview of the key findings in this report concerning HIV patients, HIV patients' fear of visiting clinics?
So thank you. And just as a background, Rishidze is a community-led monitoring initiative that is made up of 5 PLHIV sector organizations. And as the community, as people living with HIV, as people who are, as key populations, and as people who are using the public healthcare system, we go out quarterly and monitor 128 facilities in Gauteng to assess the HIV and TB services. In this quarter, we found, and we based the report on the Q4 data, we have found that there is a slight decrease in the waiting times in Gauteng. However, that 35 minutes is 35 minutes too long still, where we still have patients waiting over 3 hours to get key services in the facilities.
Based on the survey conducted, I'd like to find out from you, what were the specific methodologies employed or adopted in conducting the survey?
So when we do community-led monitoring, we follow a mixed method approach where we collect quantitative data in facilities, where we conduct surveys amongst facility managers, amongst public healthcare users, those living with HIV, as well as general public healthcare users and key populations who visited the facility. And in the communities, we also conduct qualitative data, because in the communities, that is where we find people who've disengaged completely from care. Once you don't want to go to the facility anymore, you don't, reach out to go to the facility. So obviously we wouldn't be able to find those people there. That is why we go into the heart of the community to do in-depth interviews, to do individual testimonies with those in the communities. And we also conduct qualitative data collection and quantitative data collection amongst key populations, those in the communities and those also visiting facilities.
But I'd like to also inquire from you, did your survey show any common themes, for instance, or patterns emerging from the stories or experiences shared by the victims? And also, did any particular incident stand out for you?
So when we do our monitoring, we've got several indicators that we touch on. We've got issues around staff attitudes, which we have found are quite high in the province, where we're finding only 65% of people, as you stated earlier, thought that clinic staff were always friendly and professional. And what we are saying is that having people waiting 3 hours, to receive treatment, issues around staff attitude, being refused treatment is one of the key issues that make people to stop to stop taking their treatment and
Rambau, are you there?
So the guidelines state that their treatment should rather just be given their treatment and not be given the runaround, and that's not the case in most instances. The same when we talk about giving people a longer supply of ARVs. We have found that, in Mpumalanga, in the other province that we monitor and that's doing quite well, 71% of people living with HIV reported getting a 3 to 6 month refill. So giving people a longer refill means that we decongest the facility. It means that our public healthcare workers won't be as overburdened and as exhausted, because we've got people who are literally just going in to collect treatment and then go back home.
Yes, permit me to interrupt you. I want to understand the mindset of healthcare workers. In terms of stigma and victimization reported by HIV patients, were there any specific factors or behaviors of health workers that contributed to these fears?
So let's maybe start on the side of key populations. A lot of key populations, and when we say key pops, we're referring to gay, bisexual, and men who have sex with men, sex workers, people who use drugs, as well as trans people. And what we have found is that when people who use drugs, for example, go to facilities to try and access their treatment, they are turned away and told that they either should go and bath, or it is not their fault that that as healthcare providers that you decided to take drugs, you should just go and die, or whatever the case may be. So it's instances like that where one might take their beliefs, their spirituality, and bring it to work, and then we do not provide healthcare to people who really, really need it, and not provide things like HIV prevention, specifically offering PrEP, having lubricants available, and then the whole situation becomes off-putting for key populations and not wanting to go to the facilities at all.
All right, thank you so much for that update. Ndihuwo Rambau, Retize Project Coordinator. Thank you so much.
Thank you for having us.